Private dentists, in this next episode, we'll be focusing on how to answer the million-dollar question in dentistry. How do I continue to attract new patients in the middle of a recession? How do I provide an emotional and impactful and memorable experience that makes patients want to come back to my dental practice? Stay tuned for practice management tips.
Welcome to Dental Business Excellence, the podcast dedicated to inspiring dentists to achieve optimal growth and success in their practices. Here, top dental experts will share their insights to bring the latest technology, tools, marketing techniques, practice management strategies, and business solutions that will help increase your bottom line. Here are your hosts, owner of AMP Dental SEO, Adrian Baines, and CEO of White & Associates Practice Consulting, Christian White.
How does a private dentist continue to attract new patients to their dental practice in the middle of a recession? This is one of the million-dollar questions in dentistry, and it's going on right now. This week, there's an article that appeared in the Wall Street Journal focusing on recession indicators. And they're looking at consumer spending on dentistry because it's so highly voluntary in nature as an indicator of that. Consumer spending is down 11.3% versus last year. Consumers are spending less money on dental services, and they're taking that money and they're doing other things with it. Dentistry is not something that is top of mind with most consumers. So as a dentist, if you hear all this, now what do you do? How do you make sure that you have a steady flow of new patients coming into your practice? Here's an answer for you. The new patient experience in your office needs to be highly personal. It needs to be impactful, and it needs to be memorable. So patients will come to your office and want to continue to come to your office for the rest of their dental life in your practice. How do you achieve that? That's what I want to focus on today. Everything starts with the new patient phone call. What the front desk person says to the new patient when they call for the first time will make or break whether that new patient comes to your office or goes and calls somebody else. Here's a suggestion for you on what to say. Hi, this is Sally at Smith Dental. We love seeing new patients. How may we brighten your smile today? That right there is an impactful statement. That, if you're saying that to a new patient, that will make them want to come to your office. Nowhere else in healthcare will they get that when they call their doctor's office. That much I can assure you. That's impactful. A few other things to think about. In the course of the new patient conversation, somewhere ask the patient to schedule. You'd be amazed how many times the front desk person doesn't ask the patient to actually schedule. Next, I would highly encourage you to have call tracking on all phone calls, especially those with new patients. That's something that would be worthwhile reviewing with the front desk on how phone calls went. You can tweak on what you're saying, and you can tweak what you're saying to get better results. This is a great staff meeting to have with the front desk, and you may want to include other team members on the dental team just so they can hear what the conversations are actually like. It's actually a really good staff meeting to have. Next, always ask the patient, how did you hear about us? Where did you find us? How did you hear about us? And just let the patient talk. They may say Google, they may say your website, they may say a friend. Oh, really? Who referred you? Those are important. That's important to know because that just helps us measure our marketing efforts and that our dollars are being invested wisely. And my last thing I wanted to point out was, please don't put new patients on hold. That's not a good thing to do. That's not a good experience to have with the office for the first time. I'm sorry, let me put you on hold. That basically means I don't have any time to really listen to you. Everything at the front desk should stop if you have a new patient on the phone. In some offices, they even have a special little code signal that they use. They raise their hand, they do something to let the other staff members know that they're talking to a new patient and no one should bother them. So those are a few things that I think will really help you out. Next, you want to talk about impactful on a new patient. This is something that doesn't happen in most dental practices, but it should. The dentist should get a list of all the new patients that he or she is seeing the next day. He or she should pick up the phone and call each one of those patients and see if you can talk to them on the phone. Thank them for coming to the office and letting them know that you love having new patients come to your office. You love seeing new patients. Do you have questions? Do you have concerns? Is there any fears or any anxieties that we should be aware of, just so we can take note of that, so we can make your experience that much more comfortable for you. All of those things will just blow a patient away before they even come to your office. Again, nowhere else in healthcare where you find that. The doctor has a huge part to play in retaining new patients, and most doctors don't see that. That's important. Next, every office does this a little differently, but having a tour of the office for new patients is an idea. And it does work really, really well, especially in today's day and age when people, when they're walking into the dental practice, they want to make sure that they're safe. They want to make sure that they having a good idea of what the office looks like. What type of an experience am I going to have in the office? If you can walk people through the office and show them the clinical area, show them the sterilization area. This is something I suggested every office do when COVID was a huge problem, and COVID is still out there. It hasn't completely gone away. But some patients just feel more secure if you can do that with them. So that's just an idea, but it is very impactful. Next, all right. Speaking of COVID, for some patients, COVID is still an issue. Being safe in the dental practice is still an issue for a lot of patients. In that new patient phone call, I would highly suggest that we talk about how we keep patients safe from COVID and other diseases in the office. This is how we sterilize the instruments. These are a few things that we do, and just to reassure the patient that we have their best interests at heart. This is a safe place to come. It's clean, and you're not going to catch anything in the office while you're here, and we'll make sure of that because of the procedures we have in place. Just saying that will help reduce the amount of no-shows you have from new patients. Okay, next, let's talk about your new patient experience. Every office does this a little differently. It has been my experience that every office is successful in their own way. So take what I'm going to say, and you can tweak it to what you're doing in the office. But I highly suggest that, if at all possible, the new patients could see the doctor first, and they could see the doctor first for about at least 10 to 15 minutes alone with the doctor, just getting to know the doctor if possible. The new doctor should have a list of questions that he could ask of the new patient. Where do you work? Where do you live? Tell me about your family. Tell me about what you like doing on vacation. Tell me about your hobbies. Tell me about the sports that you enjoy. Things like that. And just so he could possibly, if at all possible, maybe write a few things down, but at least the new patient feels like, wow, the doctor's taking an interest in me. Not only did he call me the night before, wow, now he's actually asking me about what I like. Wow. And guess what? The doctor enjoys football. I enjoy football. The doctor enjoys swimming with his family. I enjoy swimming with my family. You may even find that the doctor and the new patient have some common ground. Again, this is what we're talking about when we're talking about an impactful, memorable, and personal visit to the office. Doing this little piece could have a huge, profound effect in reducing your no-shows and also increasing dental acceptance in this first visit and throughout their dental career that they come to your dental practice. Next, in the new patient appointment, if the new patient sees the doctor first, great, then gets over and talks to the hygienist. I highly suggest that the hygienist at some point use your intraoral camera and take photos of the patient's mouth just so they can see what's going on in their mouth. You may not find any decay. You may not see any issues. They may have no periodontal problems, but it's good that they can just see how powerful the intraoral photography is, because that alone that's a technology piece, and that will make an impact on them. They can say, wow, here's what my teeth actually look like. Wow, this is a really big deal. And just by if the doctor comes in, does the exam, and does find dentistry to do, if you could take photos of it and so the patient can actually see it, that is another huge piece. Most new patients are very sensitive to being sold to, is what the patients call it. In dentistry, if we want the patient to accept our diagnosis, they need to see it to believe it, especially if they're a new patient. That is really, really important to do that. I highly recommend doing that and not to skimp on that. Not to skimp on that piece. Those are all very important pieces. Next, if we do find dentistry to do and it's on a new patient, the new patient needs to know that the dentistry is affordable. They can afford to do the dentistry. Well, how do we do that? The financial policy should be made aware. The new patient should be made aware of that. These are the systems we have in place for you to be able to have the dentistry done that we know that you need to be healthy. We have care credit in the office. We have other payment ways of paying in the office that allow all of our patients to be able to make it affordable on a monthly basis so they can have the dentistry done. It's important for them to know that. That's a big deal. Most offices don't talk to the new patient about that. So they get, oh my goodness, it's $1,500. I don't have that. I can't afford that. Goodbye. And they leave. So make sure you don't leave that piece out. And the other piece that's really important that is also impactful is how, as a new patient, do I pay my bill? How can I pay it and go? Here, I want you to understand this new phrase in dentistry: pay and go. Pay and go. This should be not a time-consuming activity to pay my bill. In dental practices today, most dental practices are starting to have wireless payment systems in their offices. They have a wireless kiosk in every operatory. So the patient's bill today is this, and you can go ahead and pay with your credit card today. All you have to do is slide your card across here, and you can pay your bill. And you can do it, well, we can do that in the dental chair or in the hygiene chair. That makes a huge impact. Either they're paid, they get up, they walk out, they say hello to Sally at the front desk, and they leave and they're on with their day. And that was a great experience. Most patients waste between 5 and 10 minutes at the front desk trying to figure out how to pay their bill. That just erodes the impactful, memorable new patient experience that we're trying to have them have. How they pay their bill is now just as important as the conversation they have and the interaction they have with the doctor and the hygienist and the rest of the dental team. That's something for you to remember, and just kind of don't forget about that piece. So these are a few suggestions today that can really make a difference in your dental practice. Again, this will help the new patient have a memorable, impactful, and emotional experience in your office, which is what most patients want, and it will keep them coming back to your dental practice. So thank you very much, and take care, and we'll talk soon.
Thanks for listening to the Dental Business Excellence Podcast. Be sure to subscribe on YouTube, Apple, Spotify, or wherever you listen to podcasts so you don't miss the next episode. While you are there, leave us a rating and review to help us spread the word about the show.